Yeah, yeah, that was a great point. That thank you again for the things you said. Gives me a really good understanding, and I think it will give to other people as well when they watch it. And for both of you, you both trained hundreds or maybe thousands of therapists. What qualities do you see in those who become truly effective CBT clinicians? Is there something they all seem to have in common?
I think there are several things. I think the basic thing is that they have such wonderful personal values. So to be a really good CBT therapist, you have to be just a really nice person, a really nice person who likes to help other people. So that's kind of the basis of it. You know, when patients come into our offices, especially if they either haven't been in treatment before or they've been in treatment before with therapists who weren't so kind or weren't very competent, I think it's an act of courage, really, for them to come to a therapy session, especially at the very beginning. And you need to be a nice human being who's going to do everything you can to make that patient feel safe. One of the things that I tell trainees is it's important to treat every patient at every session for your entire career the way that you would like to be treated if you were a patient. And if the therapist doesn't start out being a kind person, that's a hard thing to teach people. Okay, but it takes obviously much more than confidence. I think an excellent CBT therapist, much more than, I'm sorry, let me say that again. It takes much more than just kindness to be a good therapist. Um, I find that the people who become really outstanding CBT therapists value competence. They value professional and personal growth, both. They really see learning CBT as a lifetime endeavor. They seek out training and from other people and a lot of self-education too throughout their careers. Another quality, and this is what my dad, Aaron Beck, was so, it was a value that he was so strong in, and that is to be curious. Now, curiosity really serves you well when you have a client who poses a lot of challenges to you. I remember I had a patient with narcissistic personality disorder, and at every session, he would use one of his narcissistic coping strategies with me. So it was either criticizing me or demanding special favors or something else. And it was very important for me to get curious about why it is that he used those strategies. And I understood that the reason that he was posing these challenges to me in treatment was because he was trying to protect himself. You know, there were times when he truly saw himself as a superior person, but it's as if that evidence didn't stick in his mind. And underneath that was a very strong belief of inferiority. And here he was coming to someone who had obviously much more expertise than he did in psychotherapy. And he had to put himself kind of in a subordinate position. And so he was using these strategies to try to make himself feel better and appear superior to me. So fortunately, I was well along in my career by this point, and when he used these strategies, I didn't have a core belief of incompetence that had gotten activated, because I think that that is a belief that many beginner cognitive therapists, CBT therapists, have. Now, it doesn't mean that they necessarily feel incompetent as a person, but they feel incompetent as a therapist. And frankly, they are so much less competent when they first start than they're going to be a year later or 5 years later or 10 years later. And it's very important when the therapist's negative emotions get activated for them to do a lot of work on themselves between sessions. And one of the things that they need to learn is how to become curious when problems arise in the therapy session so that they can conceptualize it. So they can say to themselves, well, no wonder he's doing these things. It's because if he doesn't do those things, his core belief, his negative core belief, probably about himself and about other people, including me, these core beliefs are going to get activated. So now I just have to figure out when that happens, what I should do. And that's why it's important for people either to have supervision or peer consultation for their whole professional careers. I'm so lucky because we have a case conference every other week at the Beck Institute. And I always bring my most difficult clients and get some advice and hear about other challenges that the therapists at Beck Institute face. But I think that, so you said what kind of makes a really competent, really great CBT therapist? It's someone who is humble and wants to continue learning and understands that this really can take a lifetime. I think I'll just leave it at that.
Yeah.
In addition to the qualities that Dr. Beck described, so kindness, right? This willingness to learn, the curiosity. I think I only have probably one more to add, and that is flexibility, right? In order to be able to deliver individualized, really highly tailored treatment to a client, just like as Dr. Beck described, right? Thinking in the moment, conceptualizing in the moment, you have to be flexible. And that is something that I think we do a really good job of teaching and supporting at Beck Institute. Aslam, as a certified clinician, you know that at Beck Institute, we don't follow protocols. Protocols are a fantastic tool for research to see what sort of interventions may work for a specific diagnostic group and what might not work for a specific diagnostic group. But yet, when you're sitting in front of a real patient, right, we don't follow a specific protocol, and more so, we really come up with a unique treatment for them. And to be able to do that, you really, once again, have to exude that flexibility and be willing to change things on the fly. So those who are kind, willing to learn, curious, and flexible seem to do exceptionally well throughout their professional career as CBT therapists.